Welcome to the Deep Dive. Today, we're looking at something really crucial, diabetes blood testing. We want you to get informed fast, especially about what it means for you and where to get help.
Exactly. We've dug into the info from Blood Test UK, our goal today. Break down why this testing is so vital, the benefits, really, and importantly, pinpoint where you can get tested if you're right here in Peterborough.
Okay, let's start simple. What actually is a diabetes blood test? It sounds straightforward, but what's it checking for?
Well, at its core, it measures your blood sugar levels, glucose. Your body uses sugar for energy, right? But too much sugar in your blood over time, that can cause some serious damage, silently. We're talking eyes, nerves, heart.
So this test is like an early warning signal.
Precisely. It helps doctors see how your body's handling sugar before major problems kick in. It's super important for taking action early.
Okay, let's dig into those benefits more. Why should someone listening right now think, okay, I need this test, what are we trying to head off here?
Well, regular testing, based on what Blood Test UK highlights, is really the key to managing diabetes effectively if you have it, or catching it early if you're at risk.
Managing it how?
By stopping those big, scary complications later on. Things like heart disease, kidney damage, nerve problems. If doctors see your levels changing from these tests, they can tweak your treatment plan, maybe medicine, maybe food advice, right when it's needed.
Not waiting until something goes wrong.
Exactly. It makes it manageable. Now, Blood Test UK mentions a couple of different tests. Should we touch on those?
Yeah, briefly. What are the main ones people will hear about? Keep it simple for us.
Sure. The two most common are the fasting blood sugar test. That's after you haven't eaten, usually overnight. Gives a snapshot.
Okay, a snapshot in time.
Right. But then there's the HbA1c test. This one's really interesting.
Why is that? What makes the HbA1c different?
Because it's not just a snapshot. It cleverly measures your average blood sugar over the last, say, 2 to 3 months.
2 to 3 months. How does it do that?
It looks at sugar attached to your red blood cells, something called glycated hemoglobin. Since red blood cells live for a few months, it gives this longer-term picture. It shows how well things have been controlled overall, not just based on what you ate yesterday.
Ah, I see. So it smooths out the daily ups and downs, gives a more stable view of your health.
Spot on. It helps doctors understand the bigger trend.
Okay. Benefits are clear. The test makes sense. Now, the really practical bit, especially drawing from Blood Test UK's local focus, if I'm living in Peterborough, where can I actually go to get these tests done?
Good question. The info points to several accessible NHS options. You've got major places like Peterborough City Hospital and also the Central Health Clinic.
Right, the bigger centers.
Yeah. But also, crucially, your local GP surgery. That's probably the first port of call for many. And scheduling seems pretty straightforward these days. Often online booking is available, which makes it easier for people.
Okay, accessibility sounds good. What about cost? Is this something people need to budget for?
Generally, if a doctor recommends the test because they think you might be at risk or need monitoring, these NHS tests are free. It's seen as vital public health.
Sounds good to know.
And there's local support too. Blood Test UK mentions groups like the Diabetes UK Peterborough group. Great for advice and just talking to others.
And if someone wanted to go private, maybe for speed?
Yeah, private options exist. The source suggests costs can range maybe £50 up to around £200, depending on the test and clinic.
Okay, so wrapping this up, thanks to the information pulled together by Blood Test UK, we've covered the huge benefits of testing, especially that HbA1c average and the where, specifically the local options right here in Peterborough.
Exactly. And it brings up a really interesting final thought, especially when you look at the numbers Blood Test UK provides. They talk about levels in WMAL. Don't worry too much about the units, but there are specific ranges.
Like thresholds.
Yeah. For instance, a fasting sugar level between 5.6 and 6.9 millimol might signal prediabetes. That's before full diabetes. So the question for you listening is, knowing that these specific numbers are windows into your future health, maybe even before you feel sick, how proactive will you be? Will you seek out testing and actually use those numbers to manage your health?